Hi, my name is Janice. On behalf of my group, we would like to begin by acknowledging the traditional custodians of this land, the Darug people, and pay our respects to the elders both past and present, for they hold the memories, traditions, and cultures of Indigenous Australia. The following discussion will explain the role of Aboriginal culture and beliefs in health, the various factors contributing high rate of diabetes mellitus in Aboriginal communities, and why the nurses need to have Aboriginal cultural training and education to provide safe care in remote areas. According to the Australian Institute of Health and Welfare, the incidence of diabetes mellitus in rural Aboriginal people is 4 times higher than the Australian non-Indigenous community. Between 10 and 30% of some Aboriginal communities are afflicted with chronic diabetes mellitus. For Aboriginal healthcare programs to be accepted, the community must be involved and a partnership with the community members must be created based on respect and understanding the Aboriginal cultural protocols. In other words, just trying to provide healthcare alone is unlikely to lead to improved outcomes. To deliver competent and safe care to remote Aboriginal patients with diabetes mellitus, the nurses need a special education to encompass cultural awareness and environmental training, as well as technical skills and education. The objective of this presentation is to identify factors which influence culturally appropriate nursing care for Aboriginal patients in remote locations who have been diagnosed with diabetes mellitus. On this slide, you see a map of Aboriginal Australia. Aboriginal and Torres Strait Islanders have been the inhabitants of Australia for more than 40,000 years. They used to rely their lives in hunter-gathering until the European colonization. They have strong spiritual links to family and land, which was characterized by oral culture. Since European settlement, Aboriginal and Torres Strait Islanders had to suffer socially and economically, which further led to loss of many of their languages. There is no typical Aboriginal person. The country is important to all Aboriginal nations and people. However, as a group, they have wide cultural diversity, geographic and social cultural variances, which means that Aboriginal patients need to be supported with a broad range of strategies which provide personalized and individualized health care. Health professionals such as registered nurses should be concerned about cultural protocols of Aboriginal people when they are providing healthcare. Support for these individual protocols covering areas such as communication or etiquette can be provided by Aboriginal elders, community members, and Aboriginal land councils. Overall, there remains a gap between Indigenous and non-Indigenous Australians' health outcomes, with the registered nurse playing an important role in supporting and enhancing health care. To Aboriginal and Torres Strait Islanders, health is about so much more than simply not being sick. It's about getting a balance between physical, mental, emotional, and cultural and spiritual health. Another aspect of health care includes traditional Aboriginal healing. Knowledge, practice, and viewing the world to Aboriginal and Torres Strait Islanders are culturally grounded. Aboriginal and Torres Strait Islanders believe in the traditional healing such as Ngangkari traditional healing, where the healer goes to people's homes and heal them through the touch. Traditional healing cannot be learned by the one who does not belong to their culture and heritage. In the Western Sydney, there are healing centers such as Babayan Healing Centre, which are run by skilled elders of Aboriginal and Torres Strait Islanders, where they share knowledge to the younger generation. It is important to integrate Western medicine and Aboriginal and Torres Strait Islanders tradition healing for optimum health benefits. But there is still lack of correlation between Western medicine and tradition healing because of the differences in the techniques. On this slide, we will explain the relevant Aboriginal and Torres Strait Islanders social determinants of health related to diabetes mellitus. Social determinants are functions of the circumstances in which people live, work, and grow, largely shaped by the distribution of resources and the power. These determinants are closely linked to immediate exposure to environmental risk factors such as working conditions, housing, water, and sanitation of healthy lifestyle. According to Diabetes Australia, many Aboriginal people experience disadvantage through a lack of access to education, employment, income, and housing. Adults who have a low socioeconomic status are more likely to die prematurely from diabetes and have more chronic diseases risk factors than those of high socioeconomic status. This is certainly the case of Aboriginal people, where life expectancy is lower than in non-Aboriginal people, which explains lower socioeconomic status. Poverty. Poverty begins for Aboriginal communities where they were forced to relocate into reserves, small pockets of land with no infrastructure, planning or economy divided to develop these relocated people. Access to their traditional ways of being have been destroyed. Lack of shelters, poverty, healthcare, and food resulted in diseases, death, and destitution. Early childhood services and education. A positive early years and quality preschool education provide the foundation of a healthy life. The risk of an unhealthy childhood is especially high in poor socioeconomic circumstances. Factors that may improve educational outcomes in these early years include promoting the attainment of school readiness, strong community engagement, cultural connections, supporting preschool attendance, developing numeracy and literacy, and promoting an awareness of the child's skills and abilities. Unemployment. Respected and secure employment and regular income are essential to the health of Aboriginal and Torres Strait Islander people. Access to employment provides Aboriginal people and Torres Strait Islanders the resources they require to improve their health and well-being. Lack of access to health services. Access to public transport is poor and there is an over-reliance on private vehicles to access healthcare. Research has shown that the greater the distance from the health services, the lower rate of access to those health services. A reduction in access to health services has a profound effect on the prevention, detection, and management of diabetes. Health risk factors refers to the behaviors, characteristics, or exposure that increases the likelihood of a person developing a disease. When people have multiple risk factors, the likelihood of developing the disease is heightened. Risk factors can also increase the severity of the disease and the likelihood of developing complications or other diseases and can compromise efforts to provide optimal care to people who have already have the disease. Role of nurses. Nurses provide crucial support. Some will provide physical care if it is needed. Others may provide advice and support. They can talk about any medications that you need to take. They are there for you and your family to share feelings and emotions. Nurses play a very important role in their all duties such as supportive care, proper drug administrations, plan to achieve goals, provide safe, infection-free environment in hospitals, psychological support, and maintenance of records. On this slide explains the risk factors and modifiable risk factors of diabetes mellitus. Diabetes mellitus is a disease which comes in a variety of types. The range of social conditions and comorbidities associated with these conditions are numerous. Distressingly, many of these factors are present in abundance in the remote Aboriginal communities in varying degrees. Social issues which directly have an impact on the pathophysiology of diabetes mellitus include poor diets, which are high in sugar and low in nutrients, as well as obesity due to poor quality calories affects the diabetes mellitus patients significantly, as they have lost the mechanisms to control blood glucose levels. Increased alcohol is an example of these empty calories, and alcoholism is predominant in many Aboriginal communities. Smoking amongst this population is also high, and this behavior causes significant destruction of blood vessels in the presence of diabetes mellitus, which in turn aggravates the core conditions. These social conditions are actually modifiable, and with good education delivers in a culturally appropriate manner, along with the realistic support systems, as well as access to high quality affordable food and restriction on alcohol and tobacco intake, the course of managing diabetes mellitus patients in these settings actually can become manageable. Education and these supports are key components of the role of the registered nurse may find themselves involved in when working in an Aboriginal controlled community health centre. On this slide explains the considerations for culturally competent and safe nursing practice in relation to health diabetes mellitus literacy in remote areas. The Nursing and Midwifery Board of Australia 2016 identifies that nursing care planning and delivery should consider a wide range of patients originating from diverse cultural, social, and linguistic backgrounds to be effective to the wider Australian community. Not only is this a sensible platform from which nurses can base their professional activities, it is also mandated within the Registered Nurse Standards for Practice published by APRA. Aboriginal and Torres Strait Islander people, as we have already described, originate from a broad range of cultural backgrounds with significant diversity. To provide healthcare in a culturally competent and safe manner, in practical terms, healthcare delivery is not just about physical care. However, it includes also social, emotional, and cultural well-being of the community. There are several guiding principles which must be adhered to in a safe cultural care, and these include trust, cultural respect, recognition of cultural values, and tradition of the Aboriginal communities the nurse is practicing in. A holistic approach to healthcare awareness that healthcare delivery within Aboriginal controlled community health services has proven to have the highest reach and best outcomes for Aboriginal health. The ongoing and deep involvement of Aboriginal communities in all aspects of healthcare delivery is both the mantra and overriding principle of the New South Wales Health Department policy regarding the care and well-being of Aboriginal people. Various protocols exist which define care provided within New South Wales Health. These include cultural awareness and safety training pathways, along with communication standards between healthcare workers, including nurses, and the Aboriginal patients. Key and important messages are taught via a mandatory education package to New South Wales health staff. This educational program identifies that Aboriginal people have neither single culture, nor a specific language, nor do this group of people all think, look, or act the same. How nurses approach Aboriginal people is in line with the core values of New South Wales Health, these being collaboration, openness, respect, and empowerment. Nursing is best provided by developing relationship between healthcare providers and patients. Once the sense of family is achieved, Aboriginal people may feel more comfortable accessing aspects of healthcare service. Identify that to be effective as a nurse in a remote Aboriginal community setting, specialized education is needed, which encompasses cultural awareness and environmental training as well as technical skills education at an advanced level. These requirements apply equally to the chronic disease states, which plague Aboriginal communities such as diabetes mellitus. This issue is particularly relevant as the incidence of diabetes mellitus in rural Aboriginal people is 4 times higher than the Australian non-Indigenous community, according to the Australian Institute of Health and Welfare. Further, that between 8 and 30% of some Aboriginal communities are afflicted with chronic diabetes mellitus. With an increased rate of morbidity and mortality, including the uncomfortable records of hospitalization for this disease, 12 times greater than the non-Indigenous community. Overall, Australian Aboriginal have the 4th highest rates of diabetes mellitus in the world. For Aboriginal healthcare programs to be accepted, which is precursor for any success, the community must be involved. Cultural training allows for the registered nurse to understand the role of the elders in the local community, their role in group, and the level of trusted support they may give to any healthcare programs. Just trying to provide healthcare alone is unlikely to lead to improved outcomes without this buy-in. Aboriginal people listen and take their health information from the elders in the community as opposed to the non-Indigenous healthcare workers. The gap between remote Aboriginal and Indigenous, non-Indigenous occurs for a wide range of reasons, including these communication pathways. When delivering health education to remote Aboriginal people, it is important to consider what is occurring in the community at the time. Sociocultural events such as celebrations or community events take precedence over health education, and important messages may be missed opportunities if the timing of education is not considered in this broader context. New South Wales health policy is to work through the Aboriginal community-controlled health services where possible, as this has been proven to provide the best outcome for Aboriginal people. To achieve change as a registered nurse in this environment, all of these factors are taken into consideration. Unsurprisingly, Aboriginal people do prioritize care when it's available and physically and emotionally welcoming. Therefore, it is important to be respectful to the patient with a gentle demeanor, maintaining confidentiality, and being accepting of whomever the patient chooses as personal supporters during the health interventions. There is also a need to consider the competing demands a remote Aboriginal may face in attending health appointments due to lack of transport or family requirements such as caring for the family unit. Therefore, flexibility in appointment times and willingness to follow up with the patient and reschedule them several times may be needed. This should be done with an accepting nature and will be seen by the patient as welcoming and a part of the Aboriginal way of doing things. This is an example of the relationship development between patient and nurse. Aboriginal and Torres Strait Islanders give priority to their cultural identity, which impacts on their health and all decisions affecting healthcare. They believe in the traditional healing and to have an optimum health. It is vital to integrate Western medicine in their traditional healing. Aboriginal people are 3 to 4 times more likely than non-Aboriginal people to develop type 2 diabetes. And this is due to various factors such as the impact of historical and political events, low socioeconomic status, lack of access to health services, and higher rates of obesity, physical inactivity, and smoking. To deliver competent and safe care to remote Aboriginal patients with diabetes mellitus, the nurses need a special education to encompass cultural awareness and environmental training as well as technical skills education.